Hello, I'm Mariette DiCristina, the Dean of the BU College of Communication. I'm also an alum of COM and of Boston University and a parent of a recent BU grad. Welcome to this afternoon's COM Talks event covering COVID. The event is being recorded and will be available later on COM's website and YouTube channel. After discussion with the panelists, we'll have time for your questions. And when you ask them, please do type them into the Q&A box at the bottom of the screen rather than in the chat. With the pandemic resurgent despite the vaccines, how did the press perform in covering COVID and its impact in the world? And how might journalism do a better job of covering the next health crisis? And what lessons can we learn from past health crises as well? To help answer these and other questions at the intersection of media and the pandemic, we have an outstanding panel today. I hope you'll please join me in welcoming them. So let's say hello first to our speakers. Lara Salahi is a faculty affiliate at Boston University's newly formed Center for Emerging Infectious Disease and an assistant professor of broadcast and digital journalism at Endicott College. She's also the executive producer of Track the Vax, a weekly podcast by MedPage Today and Everyday Health that breaks down the process and science behind the COVID vaccine and the largest mass vaccination program in US history. Her book, Outbreak Culture, the Ebola Crisis and the Next Epidemic, examines each phase of the largest and deadliest Ebola outbreak to date and the fractured system of global outbreak response. Lara received a dual undergraduate degree in broadcast journalism and international relations from Boston University, a master's degree in health communication from Emerson College, and a doctorate in education from Regis College. Welcome to you, Lara.
Thank you so much for having me, Maria.
So glad you could be here. Now let's say hello to Paige Smith, who's a reporter at Bloomberg in Washington, DC. Her series of stories on the lingering effects of COVID recently won first place in its award category from the Association of Healthcare Journalists. Yay. Previously, she covered the State House for the Boston Business Journal, and I'm proud to add, served as an editor for the Daily Free Press, the independent student daily here at Boston University. She graduated with her journalism degree from COM in 2018. Paige, so glad you could join us.
Thanks for having me.
Now let's say hello to Lei Guo, who's an associate professor of emerging media studies here at COM, as well as an affiliated faculty member at Boston University's Department of Computer Science and a founding faculty member at the Faculty of Computing and Data Sciences. Her research focuses on the development of media effect theories, computational social science methodologies, and emerging media and democracy in the United States and China. Recently, Lei has been leading a research project that examines international news coverage of COVID-19 and its impacts. Lei earned her bachelor's in journalism at Fudan University in Shanghai, her master's and doctorate degrees in journalism from the University of Texas at Austin. Lei, we are so lucky to have you here with us at COM. Welcome.
Thank you.
Thank you so much. So Lei, let's start with you if you don't mind. You've studied news coverage of the COVID pandemic, and last fall we even talked about that at another COM Talks event, which I really appreciate. I learned a lot. We discussed some of the trends you were seeing at that time. How's media coverage differed from coverage in other countries, in the US compared with other countries? And what do you think accounts for those differences?
So thank you for having me. I have been examining media coverage of different issues, including COVID-19. So since last March, so I have been observing how news media of different countries cover this pandemic. So I see a lot. I have a lot to say, but I will be brief because I know we will have questions later. So in that project, we looked at the media coverage in US, UK, Germany, China, South Korea, and many other countries and regions. And we see a lot of similarities and differences. So definitely we see cultural and the political differences. So for example, throughout the news coverage here, mask mandate and social distancing have been a major issue of coverage in the United States and many Western countries. But as you can imagine, this is not something controversial at all in a lot of the Asian countries like China, because people just do it. People follow what the government suggests, and then mask mandate is never a controversial topic. But here in the United States and also in UK, it's always controversial, right? And so that's maybe because of the cultural differences, because here people value freedom. A lot of people think this is not something that they want to do. So I see a lot of political and cultural differences in covering an issue like this. Another thing that I found that is very interesting is about how the diversity of the coverage can be. So if you look at the Chinese, because I'm originally from China, so definitely I pay a lot of attention to Chinese coverage of the issue. So if you look at the Chinese coverage of the pandemic, the coverage is very concentrated. So they just look at a few topics. So for example, government actions, economic consequences, and healthcare issues, right? But here in the United States, the coverage is so diverse. So there are a lot of different aspects of these issues on entertainment, politics, economics, sports, education. So here I was wondering, in normal time, diversity is definitely good, right? So we want to hear diverse perspectives, diverse facts, that diverse opinions. But in covering a crisis and emergencies like this, do we still want that level of diversity, right? So in communication, I studied a theory called agenda setting, meaning that the news media will decide what we think as the most important issue. So for example, if we look at the Chinese coverage, if the news media only focus on a few issues, so that means the news media set a very clear message, set a very clear agenda. We want to focus on COVID-19 as a health issue. So we want to do everything to solve this problem. However, if you look at the US coverage, there are so many diverse coverage, right? So then the media send a message. Maybe there's so many aspects that we want to care about, politics, economics. So then the public don't know whether we still want to focus on this issue as a health issue after so many months, so even years of the pandemic. And in particular, in the US coverage, I see a high level of politicization and the polarization. So the issue has been highly politicized. So that's not just me. I actually did some research yesterday to understand, how other scholars study the issue. So this is a pattern that we all found, that the issues here in the United States, not just COVID, and also like global warming, climate change, gun violence, everything is so politicalized, it's so polarized. Researchers found that politicians are mentioned much more frequently than scientists when people cover the pandemic. So to a lot of people, when they, perceive the issue, they might think this is a political issue. This is no longer a health issue anymore. And also in terms of polarization. So if you think about different issues associated with different parties, you will see a very different, perspectives about the issue. As an audience member, I hear, conflicting information, conflict facts all the time. And again, in a normal time, diversity is good. Even conflicts are good, right? Because we want to see the debates. But in a crisis, in covering crisis like this, to what extent we want to have such level of diversity in the conflicts?
That's a fascinating, you raise a series of fascinating points. I have a quick follow-up on that. And one thing that has struck me when I've heard you speak, Dr. Guo, is people often think that, well, the media ecosystem is quite fractured, but still you mentioned the power of media for agenda setting. And I wonder if you could just speak to that just a tiny bit more, because I don't know people really realize how much sway media still do have, traditional media, legacy media, on the public conversation, for want of a better way to put it.
A lot. So I did a lot of studies on gun violence, but I think we found similar patterns. So we look at how mainstream media, legacy media cover the issue, and how partisan media cover the issue. And we did public surveys to understand how people perceive the issue. And we correlate the two types of data to evaluate the relative power of the mainstream media and the partisan media. And we found that mainstream media, legacy media, they still have a very strong power of agenda setting. They determine what people think are the most important issues facing the country. So I know, like right now, we see a lot of attacks onto the traditional news media and a lot of distrust. but the media effect is still there as long as you're exposed to the image. No matter you believe it or not, you are actually susceptible to the media effect. And based on our research, especially mainstream media, elected media, they're still more powerful than partisan media nowadays.
I think you raised this as the last question for you before we come to some of our other speakers as well, but you raised some really interesting points about diversity of coverage and exploring an issue like coronavirus from multiple lenses. You talked about, entertainment and politics and sports even. I mean, everybody remembers the Olympics not that long ago and how that was changed as a for instance. And you ask of, sort of a provocative question. And when you say, is that what we would like going forward? I wonder, considering the coverage that you've seen, can you, are there any places that did particularly well in kind of juggling the diversity of coverage and the main important areas of COVID that the public needed to know about?
Yeah, so I reviewed some audience surveys in different countries. So people report that they still rely on news media to understand the facts and information about the pandemic and about the virus. So we know there are a lot of channels out there like social media, word of mouth, people can understand the issues, but still, if you're talking about the knowledge of this particular virus and many other issues, people still rely on media to understand about these issues. So I would say news media are still very important tool nowadays for us to understand a lot of different things.
Yeah, thank you. Appreciate that. Lara, let's turn to you for a few minutes, if you don't mind. Let's talk a little bit about your book, Outbreak Culture. By the way, we saw that it's out in paperback, so congratulations on that. Can you tell us first, start out about what do we mean by the term outbreak culture?
Yeah, so I think it's important for us to first acknowledge that outbreaks are sort of a crucible moment. It's this melding together of forces under an intense pressure-filled situation. And, there are responders at the beginning stages of an outbreak from a variety of agencies that sort of descend on a fearful public in unknown situations, sometimes a chaotic situation, like we've seen. And these, agencies are obligated, but not really mandated to work together. And so meanwhile, you have this sort of fast moving pathogen that's lurking. And so the common narrative in the beginning stages of an outbreak is that, there's a bad virus out there and we don't have a treatment for it. We don't know what's causing it to spread. But we'd like to think that the agencies and responders and even community members are doing everything that we can to stop the virus from spreading. We have this sort of collective action that we should be taking. But from our experiences and previous outbreaks and our extensive reporting and our experience specifically to the Ebola outbreak in West Africa, there's a question that kind of drove us and drove this book. And that is, what if what is causing the virus to spread is deliberate actions or inactions by those that we trust to protect us when an outbreak occurs? And so what we found was that there are pressure points in the outbreak response that really have little to do with the biological makeup of the pathogen or the disease itself. So regardless of whether we were looking at Ebola or past outbreaks, which we did, like AIDS and SARS and MERS, and even now as we focus on COVID-19, which is part of this updated version of our book, we found that those who are in the throes of an outbreak, and in this case in the pandemic, which we're all experiencing now, for the most part, felt a far greater stress from the political battles and the deliberate actions that occurred in the outbreak than sometimes even from the virus itself. And so outbreak culture is that culture that drives the response at the beginning stages of any outbreak. It's a mindset that leads to these inactions or actions in this intense environment. That's what we call outbreak culture. And so some examples of that, these sort of recurring themes that occurred, are sort of delays in acknowledging or strategizing or executing a response. The critical inadequacies or shortages in supplies, which we saw in the sort of beginning stages. the reluctance, resistance, mistrust, things that are even felt to this day. The need to assign blame to others, whether it's groups of people or agencies, amongst each other, internally, externally, on a cause for something, for this outbreak. And I think it's important for health communicators and journalists to recognize that this outbreak culture exists, because this can help us provide a clear indicator of what types of stories we should be looking for when an outbreak occurs. Because if we know that pattern exists, we can shed light on those dysfunctions and even perhaps shift that culture of outbreak response, which is what we call for in this book.
So thank you. I mean, this so fascinating, this idea of outbreak culture and being aware of how that is shaping up for any given outbreak or health crisis. So your book focuses mostly on Ebola, and you've just mentioned now, there are lessons to be learned for other responses to COVID and others. Well, can you tell us a little bit more about some of those lessons in addition to being mindful? And do you have any advice for journalists or professional communicators or students who are listening to us now?
Yeah, I mean, I think some of the lessons that we can kind of take from this is how important media literacy is and communication is in outbreak response. And I think that's sort of relevant to our community here in COM, is that our jobs are so important. And there's not enough of us, and there should be more of us. And so I commend the students for choosing this path for sure, because it's my first love, it's my only love. In a career path. But I think what's lacking in our education system is media literacy, but certainly more specifically news and information literacy. And I think there should be some mandate there on offering basic news and information literacy, because we have seen how much messages, like Dr. Guo had described, really dictate a mindset, but also behaviors. And that is certainly the case in this outbreak and previous outbreaks as well. I think what's also important to mention too is just the importance of local news. And if you asked me this as a comm student back in the day, I would have said, oh no, I want to get right to the network, right? And make the biggest impact, right? But I think now, having experienced so much, it is so critically important that in order to build trust and in communities during a very fearful and chaotic environment where the science is changing and the messages may be changing, it is so important for communities to rely on their local news. And I'll give an example of that. As we were covering the Ebola outbreak in West Africa, certainly outbreak culture had taken hold there, which is the premise of this book. Initially, a lot of the health campaigns were sort of a blanket approach, right? It was a one size fits all, whether it was in Sierra Leone or Liberia or Guinea. And it wasn't really until, and again, this is a region that has just come out of the throes of a civil war. And so there's deep distrust in authority, in government. And there was a deep disbelief, and even to this day, among some people that Ebola even exists and was even an outbreak. And so I think a major turning point in acknowledging the existence of Ebola, and also a major turning point in the outbreak itself, was the implementation of community partners, of those at the ground level, and the messaging from local journalists, especially in radio, but from local journalists in delivering the message to communities. And so I think that local news is so important. And the third point, I'll just, to be brief, is the importance of having science literate journalists. And this is clearly, I mean, Mariette, this is our jam, but yeah, but I think it's so important to have science literate journalists that are at the front lines of those who are tasked to send messages to the public about the direction of our outbreak response. And I'll sort of leave it at that. We can talk more about that.
Yeah, actually, just a quick follow-up on that, Lara. I mean, how do you feel the journalists were prepared, when they were trying to cover COVID, the folks sitting in on briefings from the Trump administration, for instance, and others, as far as that science literate filter?
Yeah, I certainly think that there is, I'm an educator too. So I'd like to say, I'd like to meet the students where they are. And so, if in a circumstance or situation where, local news is being gutted, right? And we're strapped for resources, it's very difficult to kind of put a grade on how journalists did, right? At the network level, depending on the organization, it really varied. And depending on the journalists themselves or even the strategies that were in place, it's very difficult to kind of provide a blanket approach and say, we did an awful job, or we did a great job, or we did a mediocre job, right? But what I will say is that there wasn't enough science literate journalists, and there still isn't enough. What I mean by science literate journalists is just the importance of those who are able to decipher, the type of information that is being given. And I think, Mariette, you were pointing to the press conferences by the coronavirus task force, I think is what you're talking about here. And initially, those that the coronavirus task force that was put together by the Trump administration had a sort of an equal balance of health experts and politicians and politicized health experts, was sort of run very unfiltered. That networks were initially running these press conferences from beginning to end live. And then, the type of misinformation that was brought forward by those, conferences really did a disservice to the public. And I think we saw that in various different ways. The touting of treatments, the descriptions of things that were not necessarily driven by science, at that moment. And so, those who were sitting in the audience, the journalists that were there, were the White House press corps, and they're not health journalists, right? They're political journalists. And so the types of questions that a health journalist would ask would probably have been different than those who are political journalists. And so I think that, organizations sort of need to re-strategize a bit on how to approach, infectious disease outbreaks or other health news stories as they come.
Thank you, Lara. So just a quick recap before we, I'm eager to get to talk to Paige as well. So we've heard from Lei about the power of the media for agenda setting, and that the media have looked through these health crises stories through a variety of lenses, from the actual health information to how they affect things like sports and other areas of our lives, and how these areas of communication can be politicized, which presents challenges. Also, when there's an outbreak, this sort of outbreak culture that shapes ongoing reactions and perceptions of those reactions. We've talked a little bit about the importance of media literacy and the importance of local news as trusted messengers for media information, and also the importance of literacy in science journalists and any journalists rather, and also that all this has happened recently in COVID during a time of ongoing tremendous continuing change. Not just for journalism, but in media overall, and that's added its own complexities. So, Paige, turning to you, if you don't mind. Now, you cover workplace and labor issues for your beat at Bloomberg. How well do you think the media tackled the pandemic's impact on the economy and work life, which obviously changed a lot for a lot of us, as opposed to the political or medical angles?
Yeah, thank you. First of all, thank you so much for having me. I'm thoroughly enjoying the discussion, and it's kind of triggering other story ideas or just the idea to think more critically about coverage overall. But I think to kind of piggyback on what Lara was saying, just the idea that, as journalists, you are constantly in, not just response mode. Obviously, you're thinking critically at any point in time, but as the COVID pandemic was really unfurling, it really was response mode, especially for folks like myself who I'm not a health or science journalist, and I know my area of coverage, and I understand how different areas of the law are impacted by this, by the pandemic, but to kind of analyze the intersection of those two and then write on it very critically, what I'm trying to say is that it all happened very quickly. So I think that kind of goes back to the point of media literacy, because if folks understand how a story comes to be from the initial reporting aspect to just what you see in an Apple News alert or blast on your phone, I think that there's much more of an understanding where journalists are coming from and how they think about these ideas critically. So to answer your question of how we covered it, I think that everyone can always do better and do more, and there can always be more coverage, and there can always be more journalists. But there are also realistic constraints on the news industry overall, and I think that everyone is just trying their best. I know that doesn't necessarily answer the question, but I think that there's always more to be done.
For sure, and I especially like to endorse your call for more journalists. There always can be more journalists. The pandemic affected almost everybody's workplace, so following up on that, and newsrooms were no exception. People were locked down, newsrooms were locked down. As somebody who was working in Washington among a high concentration of reporters there, how did the pandemic affect your work and the work of your journalist colleagues, and how did it color or shape the coverage?
Yeah, I think part of it as well is that sometimes people forget that journalists are humans as well. And as you're going through this coverage, you're also, screening phone calls from your loved ones about concerns around the pandemic. And because you're a journalist, you're supposed to know the answers to a lot of things, even though you're not a doctor or you're not a health expert or you're not well versed on a global pandemic or past global pandemics. So it really covered, I think, a lot of our coverage, because as you as a human are having these questions, it's sort of like, well, gosh, if I'm having these questions, I'm sure that my neighbors are having these questions, or I'm sure that employers are having these questions, or wow, this is an interesting law. I wonder how that interacts with an interesting workplace law. I wonder how that interacts with these mandates that are coming out, or is this infringing upon X, Y, and Z, and how can we explore that? So to your question of how it really impacted Washington overall and newsrooms overall, I mean, we also weren't with our colleagues for 18 months, just the organic generation of story ideas over coffee or meeting with sources in person, or maybe having less formal conversations versus, taking that moment to type out an email. A lot of things changed, but I think that it also, a lot of things changed for the better, perhaps. I think that, there are journalists that can now do their job from not being in the middle of Washington and do their job very well from not have to live in an urban center, if you will. So I think that we can quibble over the effects of the pandemic all day, and it's going to be very fascinating to study in the long term. But I think that it's also important to acknowledge that we're still in the middle of it. I mean, unfortunately, people are still dying from COVID every day. And I think that that's something that I try to keep in mind as a journalist, but we're still going through this, and there are still evolving developments, and it's not over yet.
Oh, thank you. You raise a number of important issues. So Paige, just talk to us a bit about, how covering the pandemic was a breaking all hands story where everything was happening really quickly and all kinds of people were pulled onto the COVID beat as it intersected with their own beat. And that journalists, like everyone else, had to work in lockdown, had to work remotely, how to rely more on different digital platforms than we've had in the past. And maybe there are some positives to that in the ways we live and work, because we do all need to continue to adapt over time, but also that, might have added to some of the complexities of coverage as well, when you can't sit in person with a source, or when you can't talk over in person with colleagues your story ideas. So now I'd like to address a couple of questions to all of you, as you wish as a group. And by the way, folks who are listening to us, I see some questions are starting to pop into the Q&A. Please do send them along. I promise I'm going to come to you very shortly, and we'll start to address your questions. So please pop them into the Q&A rather than the chat, and look forward to seeing what you're curious about. But a couple more for the panelists from me. What's, and maybe Paige, you might start with this, but and Lara as well. What's the next frontier for covering the pandemic, since it doesn't seem like one of those stories that's going to have a nice, clear and tidy ending? How do you think about that?
I'll start, but I think from a workplace angle in particular, as I said, it's employers are still very much grappling with how to respond to the pandemic. I think that it is still top of mind for folks because there are still so many people working from home, for example. In some ways, life has returned to normal in some components, but in many, many other ways it hasn't. So I think that in terms of covering the pandemic, it's important to still, like I said, keep in mind that it's still going on, and there are still folks who a lot of people have link their identity to their jobs. So when you so fundamentally change their routines and how they go about their day, it's inevitably going to change a lot of how they think about things and how everyone sort of thinks about things. So as a journalist, you sort of have to respond to that and ask critical questions. So.
Yeah, I would also add to that too. I mean, from a health journalist's perspective, I think we now have to sort of enter the mindset that this may very well be endemic. And so I think that as we look ahead in terms of what are the types of stories that we're going to be covering, the question is always, okay, well, when is this pandemic going to be over? And I think from a public perspective, there was supposed to be like a light switch at some point. And for those of us who've covered outbreaks before, we know that there's no clear indicator, right? And even when the WHO, right, declares something that that is no longer an outbreak, the criteria there is a little different. And it's not that it's gone, it's totally gone, right? That cases are at zero. And so, in all outbreaks and epidemics, there's sort of a tapering feeling of having it go away. But I think we're in it for the long run here. And so the types of stories is really living with, right? Living with this here. And the fallout from any pathogen and any outbreak it is sometimes the amount of the actual outbreak itself double that. And so unfortunately, not to be the bearer, I feel like I'm not to be the bearer here, but certainly, covering Ebola in 2014, that outbreak, which ended in 2016, the fallout is still being felt to this day. There are long-term effects of that, both physical, mental, social, and the health system recovering from what collectively that region had experienced is still felt to this day.
Thank you. Dr. Guo, I know you were a journalist as well before a researcher. Any thoughts on the next frontier of coverage from your perspective?
It might sound a little bit ironic, but I really think journalists should refocus the issue as a health issue, not a political issue. And it's still important to talk about those health-related messages, like how to prevent getting the virus, because research shows that this kind of message is really rare covered in the news media right now, but we still need that. And back to my point about the diversity of coverage, I was wondering whether journalists can collaborate a little bit so we have a more coherent agenda, because this is a live and a death issue. It's not an area for competition. I know, of course, journalists want to compete all the time, right? Who's the one who break the story, who break the news, who has a unique angle, but I don't think this is an area for competition. So it's important for us to have a coherent agenda, so to better inform the audience. And my last point is to avoid sensationalization, because research also shows that a very dominant frame of news coverage is emotion-driven, fear and a scare-mongering frame. So of course, we want to tell the audience it's very important, but try to avoid using that kind of language, because it will make the audience feel worse. That will also lead to many, mental health related issues.
Yeah, thank you. Lei, I'd like to stick with you for a minute, and then I also would welcome Lara and Paige. But at one point, so there's the complexity of talking about different things and sensationalizing, as you've just pointed out, and talking about it as a political question rather than a health one. But there's also the sort of bad actors who didn't mean it. And at one point, I remember there was so much misinformation about COVID during the beginning of the pandemic that the WHO, the World Health Organization, dubbed it an infodemic. It was just so much info out there, some of it good, some of it bad. And journalists are not necessarily the most trusted of sources sometimes. They're as indeed are politicians sometimes. But does that present a problem for countering that misinformation or focusing on the health, as you've just recommended? Is there an alternative? Is there, what can news media do to show that they can be trusted sources?
I think I mentioned this in a different panel, but I want to repeat this because I still think it's important. I think journalists should trust their own judgment. They should trust their journalism training, so don't react to misinformation. So a lot of the times, journalists want to do fact checking, want to report on misinformation stories. But at the same time, when they do that, they increase the salience of the issue. That will make the audience believe the story is important. So I will say journalists should follow their own agenda to report on things they believe are important. Don't be driven by the agenda from those misinformation websites or those individuals. So set our own agenda.
Yeah, you remind me of there's a 2020 debunking handbook that folks can look up for approaches to think about, perhaps, and a vaccine handbook as well. Lara and Paige, anything you care to add?
I completely agree with Lei here. And I would also add, just reiterate the importance of local news and the investment of that. And I think right now some colleagues and I are working on some research looking at news academic partnerships, which I know that BU has many. So, so it's great to see that. But really how much, that is a driver of building trust within communities. And whether that resource, right, of having that type of partnership not only serves as a pipeline for new journalists, but is also really critical to fill the gaps of news and information in places where it's needed the most.
Thank you. So we have a number of questions from our audience, which I'd love to try to get to now. One from Jerry Berger. Thank you for the question, Jerry. Science literate journalists are clearly important, but what can we as journalists do to better train the scientists to explain their work to journalists? It wouldn't have helped with political journalists at the Trump press conferences, for instance, but it's certainly a need going forward. Thoughts on that?
I have some thoughts. I think that in terms of helping journalists sort of understand, it's just a lot of the times, especially when you're speaking with official, agency officials, for example, or other folks, they are so concerned about getting it right that it is gobbledygook. Like it's just not. It's very complicated, and especially for folks like myself who kind of wandered into this area and aren't not wandered into. I don't want to you know what I mean? I'm trying to grapple with the information as it's coming very quickly at me. And I think that oftentimes you're presented with a very polished, clean version, but when it comes to wanting answers or asking follow-up questions, there you're either greeted with a non-response, or there is sort of a filter put on those responses, when really we're just trying to get as much information as possible. So I think that from the folks who are on the PR side of things or on the communication side of things, it's helpful to, even if you have an off the record conversation or a conversation on background, to explain to journalists what's actually happening or what the important parts of this announcement are, or really what, not trying to direct the story in any way, but just having a frank conversation about what's going on. I think that folks really, that's so valuable for journalists. And I think that also for journalists, they have to ask to have those conversations and to raise their hands and say, I don't understand, or I need more information on this.
Can I add something?
Yes.
So
Yeah.
I don't, my answer may not directly address, Jerry, your question, but I do think scientists should take advantage of social media to get their voice heard directly. They want to try their best to directly communicate with the public, their main points. So I don't distrust journalists, but because of the nature of journalism, so usually news stories will involve experts' view as part of the story, right? But the journalists might have something else to say. So I think it is also important for the scientists, if they have a story to tell, if they have research findings they want to share, they want to use social media like Twitter to directly communicate with the public. But of course, they want to make it, clear, easy to understand to the public.
I also have often said to researchers that I if you like Facebook, you can talk on Facebook. If you'd like to do it at your school board meeting, whichever platform you're already using, just so not to make it a huge additional burden to researchers who are quite busy. But I would at the same time say that it would be great if researchers would stick with their areas of expertise when they do that. We all get in trouble when we wander outside of areas we don't know and we're not equipped to report and check. And so I think we all should always check it before we share it.
Absolutely, Maria. I agree with that. I think that, and I agree with a lot of points that they also made, but I think there are also a double-edged sword when there are experts that go straight to social media sometimes. And I think we saw that too with this outbreak, is that, there were experts who were trying to analyze, preprints and sort of put things that are, try to put information out there, and it became sort of information overload. And as a journalist who may not be health literate, to take that complex information in a tweet, right, and synthesize it and have that drive a story can also probably serve as a disservice in some situations. But to address a part of Jerry's point that that wasn't brought up too, is I think there's really an importance of access to the right people that journalists need. And I know this is such a high level kind of response to this, but we saw in the beginning stages of this outbreak where the CDC was sidelined and not, and not allowed to address reporters directly. And they're a critical part of outbreak response and have been in all major infectious disease outbreaks around the world since its inception. And so that was a very shocking moment. And so I think that access to the right experts is incredibly important. We also saw a rise of, like Mariette just described, of armchair experts, right? Those who deviated from their specialty to provide response. And so when we're looking as journalists, especially TV, I guess I can speak from a television perspective of like who to book for an expert. The ones who became most accessible may not have been, specialized in infectious disease, for example. They might have gone outside of their specialty, but offered great sound bites. And so that is also something to be mindful of there. And so when we think about how journalists can do a better job to train scientists. I don't know if the word train might be the right word here. It might make sense to, that's what makes our job so difficult as journalists, is because we can't ask scientists to be the journalist, right? It's our job to take their complex information and do that sort of very tailored approach of how do we understand this? How can you bring forward this information in a way that you would describe it to your grandmother at Thanksgiving, which is what I was always told at COM.
Still good advice today. Yeah, I mean, and there are sort of training programs and so on for scientists, but also there's finding your peers. And one thing I particularly like is the NPR SciCommers, a sort of network that provides mentoring, and it's all free for researchers who are interested in engaging with the public. So let's turn to another question from Jennifer Schmidt. Thanks for the question. In the industry, and I guess this follows on to this very conversation, are you seeing the need to further specialize? I recall in the early 90s when I was at COM, I think there was a single business journalism class and a single science journalism class. Is it experience or education or both? Thank you. This is sort of the classic nature nurture question about journalism. Anybody, any takers?
I can try to snag this. So I graduated in 2018, and I think that just having gone through the initial job entry, entry-level job market and trying to get a job right out of COM in particular. So I also did a minor in the business school at BU. So it was helpful to have some kind of background and sort of a baseline understanding of financial principles, et cetera. But I think it's just when you leave COM in particular, you have interests and kind of have a general idea of what kind of reporting you might want to do. But I think in today's journalism and media landscape, it is really, to be frank about it and realistic, it's about getting a job. And I think that there is a need for specialization, and especially when you find sort of that calling at some point in your career to really hone your interests, for sure. There is, I would say, a need for specialization. But gosh, leaving COM and just trying to get a job, it was really stressful for me, at least. That was my personal experience. Just you want to get something, and you want to be doing something that you love, which is journalism. But the idea of like, oh gosh, is my resume tuned enough to have this experience versus that? I mean, maybe that goes for if you're trying to apply to exclusively apply to science magazines or culture reporting specifically, it might be a little bit different, but that was just my personal experience.
Here's another one from Brenda Morning Lake. Thanks for this panel. The media is often accused of being biased and not open to different views or even sharing views that are considered unpopular. How would you address this criticism?
I will say something, rephrase this question a little bit. I think the problem is media polarization. Different media have their different views. I do see different views everywhere, but you can see partisan media, they usually have their views, support their existing beliefs, right? And that's the issue that we are facing now. But I think it's Lara or Paige, you mentioned media literacy. I think that's very important. So I think it's important to train the audience to be more critical when they see different media messages, when they see an unpopular view, when they see popular views. How can they try to assess the message and get the information that they need? But I think there are a lot of views out there, but the most important thing for our audience is how to critically assess those different views from different media outlets.
One thing I've also often personally recommended is if you can share your perspective on what you're trying to do, that context is helpful for the audience to know where you're coming from. So, there are ways that journalists could signal, I'm here trying to provide a report of the objective truth as best as I can do it with the tools of journalism, and there are ways to signal that, and that sometimes helps as well.
Just one more note, if you don't mind. So we have this concept called selective exposure. So from the audience side, we also have the tendency to consume media to get information that support our views. So I would suggest try to get more diverse media diet, try to walk out of your comfort zone and see more views and critically assess them.
That's an excellent point, Lei. And I would also just want to add to that too, that it's no longer enough to just fact check information. And I think, Lei, you brought this up before, is that it's, that there is a concept called my bias too, where even if a person is given information that counters what they believe and is true, right? They're told this is actually the truth. And all signs kind of point to that too, that they're actually more likely to hold on to their own truth, even knowing that it's wrong. So certainly that makes our jobs as journalists that much more harder. It's not enough to just say, well, we can just present the facts and let them decide, or we can just present the facts and surely they'll get it, right? Which is sort of that point of understanding, again, news and information literacy.
Thank you. All right, I'll toss you another one while we're on the topic of, bias and information, misinformation, from Jim Polson. Can you give an example of immediately obvious misinformation and how you dealt with it in coverage? Maybe start with Lara and Paige on this. And can you give an example of a reversal of scientific knowledge about COVID-19 and how you dealt with that in coverage? Anything spring to mind?
I'll just say, in terms of misinformation, I think that a lot of it is helpful for my job because it is so much, the coverage is rooted in the law and the intersection of, sort of how current events intersect with the law and how employers remain in compliance with the law, if you will. But I think that I can't think of an instance of misinformation per se, but I can think of some wonky ways that employers have tried to respond to what they think is a legal interpretation of things. And I think a lot of the times, I don't want to go down on a tangent, but I think that it is challenging to, as Lei said, acknowledge that there is misinformation and try to move beyond it as a journalist and report facts. It's very challenging. It's not easy.
Yeah, I want to reiterate actually a point that Lei made that I think is really great. And that is that generally, if it's obvious misinformation, the standard has kind of been don't breathe life into it. And so we generally try to stay away from covering things that are blatantly misinforming, because it tends to have a spiral effect, which I think is what Lei had mentioned earlier in this discussion. And a reversal of scientific knowledge, I think I would kind of put it as like, when we know more, right? When we know better, we do better. And so I don't know if I would mention it I wouldn't frame it necessarily as a reversal, but certainly be understanding the scientific process and bringing readers or our audience into understanding the scientific process is incredibly important, because science is not meant, we test hypotheses to debunk our own thoughts, right? We have an idea of what it is and we try to prove ourselves wrong in science, which is essentially what good science does. And so that's a teachable moment, I think, for science journalists, but also it's a teachable moment for the public to understand that things are going to change and things are going to develop and evolve. And it's not that it's misinforming or deceptive in any way, but it is part of the scientific process. And when we know better, we do better, hopefully.
I can think of, of a couple during this, of both the things that you're mentioning. For instance, I remember discussion of fallacious cures. I'm not going to repeat what they were because they're not worth repeating. by certain government officials, or relatively early on in the pandemic, some of which was actually potentially dangerous, the things that they were suggesting. And also, to what Lara was just mentioning about how the science evolves, which I agree, we should say this is a good thing about science. We don't just keep sticking to a story just because we said it before. If the facts change, then science adjusts. I think that's, or as new evidence comes in, I should say, the hypotheses are adjusted. They're either proved or disproved, and I think that is virtuous. But I remember early on there was a lot of confusion around whether you should wear masks or not. It was quite early on in the pandemic, as the health guidelines changed. That ended up, unfortunately, being a source of division and polarization when really I was just increasing knowledge about what was most appropriate to combat this spread of this pandemic. So kind of tricky. So we're almost to time. We have just a couple more minutes. And with the knowledge that there are a lot of students in the audience, and we've talked about quite a variety of things, I hope you don't mind a quick round of, if you could suggest to folks one thing to take home, from your perspective about of the number of things we've talked about today, that you might maybe emphasize or share. I would love to hear your final thoughts on that, on the idea of covering COVID and health crises. Anybody care to go first?
I'll go first then. I think for journalists and our students or everyone, I hope that we still acknowledge that the pandemic still going on. It's not over yet. So for whatever reasons, this issue is a health issue. It is not a political issue, not an economic issue. Primarily, it is a health issue. It's still there. So let's acknowledge that as an fact.
Thank you, Lei.
I can go next. I think that for journalists, I think the one takeaway, especially for student journalists, but even for any journalist that is sort of, as I was, pulled into covering this pandemic and maybe not used to covering a health issue as regularly, is just to not be afraid of asking stupid questions or what you perceive to be stupid questions, because there is no such thing as a stupid question. If you don't understand what you are writing on, then that is an issue, and you need to learn before proceeding, and you need to ask questions as opposed to just kind of nodding along with it. I think that's a big takeaway for folks.
I would say that as incoming journalists, you have an incredible opportunity here. I mean, I was taught and now teach that good journalism has the potential to change history, and it has changed the course of history. And I think that we have an incredible opportunity to have good journalism change the culture of outbreak response. And so that I'm handing that responsibility to those of you who step up to it. But hopefully we can collaboratively sort of work together with the scientific community, and even our leaders, international leaders, in every respect, to change the culture of outbreak response.
Well, these are, thank you. I think these are fantastic thoughts to end on. This idea of focus on the story as a health issue, which it is, and actually that peels away a lot of the concerns around polarization and sort of fractured cultural lines. The idea of embracing that through not being afraid to ask all the questions. Don't feel stupid about it. It's really important to get to the heart of the matter and really understand, so that you can convey the information accurately. And then where Lara brought us, the incredible opportunity that is ahead for journalists to help shift the conversation in a positive and productive way. So I hope you all will join me in a virtual applause for our wonderful panelists. I learned so much. I'm so grateful to you all. Thanks again for joining us today to have a wonderful discussion about covering COVID. And I hope everybody has a good and safe and healthy evening. Thanks very much, and bye for now.